Right. NeuroLifeNow is about capturing the daily realities of people with neurological conditions, any of the over 600 different conditions and symptoms that are recognised or acknowledged, should we say. Also, those that are not diagnosed yet but are suffering from neurological symptoms but haven't been diagnosed yet, capturing those in lived real time and then using those to influence and inform change at every level. At the moment, that's happening via pushing out of bi-monthly surveys. So they run over 2 months. So the current survey runs from July. It's running from July to the end of August, which is obviously next week, and it's focusing on questions on. So we have a focus for each of these surveys, as well as a set of questions that are asked each and every month to monitor change over time. The idea is, so with the focus questions, so this month we're asking about shared experiences between conditions. So we know there's, in terms of symptoms and issues that people present with, to capture those between conditions, and also finding out about how far people travel towards their specialist appointments. So that's our aims. We then use those to lobby or take to local government as well as national government across the nations of the UK to inform change. We're also speaking to various integrated care systems, which are basically, if not, people haven't heard of them, but basically they're the things that will or are starting to control our healthcare system in the UK over a regional area. And for example, we're working with one ICB, they're called integrated care systems or integrated care boards. And the idea is then to work with them about actually being offered feedback on their service specifically. So we'll be trialling that over October through to March in the year to come, in the up and coming year. And then we'll report back to them. We produce reports at the end of every survey, which hopefully and generally go out between 4 to 6 weeks. I say that with a slight wry smile because we've had a couple of issues with change of data analysts that we use, which caused a bit of delay, which means we sent the last one out a little bit late, about 8 weeks late. But the idea is that this is quicker response to any survey or anything that anyone can, and it partners or complements the work of the Neurological Alliance, who we work on this project with specifically. They're a partner of ours, and the key for us to have influence at national level to their patient experience survey, which is sort of a moment in time larger survey that runs over it's run every year. So we're more the heartbeat. They're the sort of real in-depth drill down into this. The surveys generally, although we know depending on people's abilities on computers and for various different reasons, the survey shouldn't take longer than 15 minutes to complete most of the time. We try to keep them as short and punchy as possible. And we're in the middle of developing version 2.0 of the NeuroLifeNow platform. It's got its own website. There's a reason why it does look slightly different than the brain and spine. We own it as the brain and spine. So anyone that signs up to it, they sign up to our terms and conditions, etc., etc. Done in relation to the Neuro Alliance policy, as you can see, and the web URL is neurolifenow.org. And you can see our reports. So the surveys are published and you'll be able to access them there. You can sign up to a newsletter. You can also see about NeuroLifeNow, and you can also find out about our reports or past insights that we've gained. So these are all our reports. We produced 16 reports up till now, and then we'll be doing more. We've got another one due out beginning of September, which is the May-June survey. And then we ask questions on that. What we try to do in terms of our focus questions for each month is we try to think, right, when is the report going to be published? So for that report questionnaire, and then we find out what's going to help inform service. So we seize an opportunity, or we look to cover off an area we haven't covered before in the focus area. And it's very holistic in its approach. So we've asked questions around, we started during COVID, so we're asking questions about COVID impact. We then started asking questions around cost of living. So those are some of the more then, but we've also asked ones that are more general in terms of social care, people's travel, how they get to places, etc., around those. So we'd ask ongoing conversations around that, winter changes, and we've also helped inform the acquired brain injury and neurological other neurological conditions bill that has been going through government. So the data has been used to go through to that, and the data has been taken up to the very top of the NHS, and we're continuing to work on that. Where we're at the moment is we're trying to grow scale. We're our highest ever completions of surveys. It used to be averaging around 350, 360 for every survey. We've now hit over 560 of completions for this survey, which is fantastic over this month from some work we're doing. We're also looking to produce some specific reports as samples towards cuts of our data towards certain conditions that are now showing, that are now presented more higher represented inside the surveys, because the people have been participating. They're going to be dystonia and migraine. Just because we've got the opportunity with those organisations, that doesn't mean we're favour them over any other. Just so you know, we want to hear from everyone, and it's important we do. And we've just completed the first phase of a redesign for what we're calling version 2 of NeuroLifeNow, which will be allow people greater ability or ways for people to share their experience, more accessible ways to share their daily realities, lived experience, depending on how you want to use that yourselves, and new ways to do that, and then other increased functionality of us being able to engage better with everyone that participates in NeuroLifeNow. So that we're hoping will, pending funding, because that's where we are at the moment, waiting for funding. We're hoping that will launch in 2024. We were hoping later this year, but realistically with funding as the way it is at the moment, we're probably looking at 2024. That being said, that doesn't stop us doing what we're doing, which is using this online tool that we're using that can be accessed via, you can access it via the website, like I will show you in a second, or you can access it via the emails that we send out to various people, or on our online, on social medias. If you follow us on NeuroLifeNow or Brain and Spine on there, you'll see links to the current survey, and then that will show you through, take you through to the web platform. There are some annoyances with it, like you have to enter your name for every survey, because we do try to get people to repeat, to answer the surveys every month, every time, if you can, because the longer we have, the greater resource, the more people we hear from, the greater power of our voice, and the greater power for change that we can have, and to improve people's lives, from healthcare through to every aspect, because we are looking holistically on this one. With regards to the surveys itself, Kate and Eva had asked me just to show you sort of how it works at this moment in time. When the new version comes out, we will talk to you about that nearer the time, and there'll be videos and other things that come out. We've got plans for the launch of that, how it will work. What you'll do is you literally click on the link, whether that's on the website here, it's right on the homepage. This is the homepage to the website. If you go straight to neurolifenow.org, you'll get straight through to the website, and the current survey is always on the website. You press click here, it will take you through to a set of questions, starting off with what this survey is about, generally, what we ask. If you see, some people have asked me some questions about this, and I get a few of these every now and again about people saying, because there's a bit of a takes 5 minutes here. Now, that's the average time it's taken the people to complete this current survey. Some people it takes longer, some people it takes shorter. It depends on how you answer the questions, because some of the questions you don't have to answer them all, depending on what you've answered in the previous question. And then other people can be a bit slower or whatever. Or if you're anything like me and my internet connection at the moment, it could just be because of that people take longer. So it's just a timer. It's only a guide. I've got no control over it, just in case anything comes back. But I can assure you, 15 minutes, we've not had anyone take over 15 minutes to complete, as far as I'm aware. So I do try to monitor these things over time. And on average, according to our survey completions, they take about between 8 to 10 minutes, most people take to complete, just so you know. So all you have to do is click start. That will take you to, first of all, the legal jargon. So my other role, operations, dealing with the risk and everything else. This just allows you to sign off and read up on our privacy policy, terms and conditions of participating in this social research. And if you've got any questions, that info@NeuroLifeNow email comes through to me. It's me that answers that, or in my absence, our illustrious and much well-spoken Constance, our communications manager, will come back to you normally within 72 hours. We try to do that, if not, to be honest with you, a lot sooner. If you don't accept, you can't participate. So I'm not saying you won't, but basically you'll just go straight back to the beginning, as you see there. However, to participate in the questions and surveys, because obviously you'll be sharing data with us, you'll need to click on I accept. And I just wanted to show you through that. And you have to apologize. My internet and computer are running slow. Hit accept. That takes you through to the next question. It should just do it automatically. You can do this off a phone because it changes the size of the screen and everything. If you're using a tablet, phone or computer, it looks slightly bigger, obviously, on a computer. Are you filling this out on the questionnaire? This is because we know some people will need other people to complete for them. So if I'm just completing it for myself, yes. And then we go through, and then the survey split up into sections. It will ask you, and it'll tell you a bit of detail of what's going on in that section. So it will ask you what conditions you have. These next set of questions are. And it will tell you if there's a star there, it means that the question does have to be completed because we need to know when they were diagnosed with their primary condition. We know that multiple people often suffer from multiple neurological conditions or symptoms. It's a bit of a loose one, this, because one condition could be a symptom of another, etc. Primary is a bit of a loose term in terms of what was the first one or the one you're most affected by. So it's how it's defined by you or what you speak to your nutrition about, and that's individual to every single person. So let's just say, I don't know, 1982. Some people don't have a clue. Just put that in. You put your year in. You then choose. Please tell us which neurological condition was you first diagnosed with. So that'd be most likely the primary one. Then you've got a long list of conditions here. It can be typed in. So you could type in, one that's close to my heart, just so you know, my parents have both suffered from neurological conditions. That's the reason why I work for the charity. So I'll just choose multiple systems atrophy, for example. You'll select that. It'll go through. Do you have another condition or symptom? I'm just going to put no, but if you hit yes, you'll go through to the same list. If you ever find, or if you find someone, we hope that everyone talks about NeuroLifeNow and gets their friends to complete. If their condition is not listed, please do reach out to us, because often it's very hard to list all over 600 different conditions and symptoms, partially to make it as accessible as possible because of the limitations of the current system. That will be improved in future, but also one condition can be a type of another condition, of an overarching one. So I found out a couple just the other day, and we add to it all the time. So do let us know. We want to make sure that people feel represented and can recognise themselves in it. So please do let us know. The list is not exhaustive. It's well over 200 now, but that's because, as I say, some conditions sit under other conditions. So we're not trying to exclude anyone. It's partly limitation of functionality at the moment and partially to keep where we are at this moment in time. We look to improve that with the next version of the survey. But every time or any questions you've got, please reach out to us. I'm hoping if anyone's reached out to me before, you'll see that we are very responsive to people's feedback. We try to be as open and honest as possible because this survey is about you guys in the community. I'm going to hit no for now, because otherwise we'll just continue repeating ourselves on how many conditions we can have. It's just the same set of questions. It goes up to 6, and then it will move on to the next question. Next, it will take you on to, have you got any other than your neurological conditions? So, for example, if you suffer from cancer, I'm just going through the ones, hypertension, these are some of the more prevalent ones, mental health conditions, diabetes, these are the more prevalent ones. You can just select how many other conditions you do. So we need to know about comorbidities. That's what they're termed as if you haven't heard of it before. So if you've got anything else around that. But again, if you've got any questions, just reach out to me on that one. Always open to hearing from people. I'm just going to select none just for ease. The next one, so that will take you through that section. That section's asked each time. You then go through shared condition issues and symptoms. This is more specific to these to the current survey. This is one question that relates to, we've picked out a series of quite catch-all symptoms, issues, and everything else, because what we need to do as a group is depending on how you do it, because the numbers are not great in the NHS, no surprise there, 11 million and 16 million people in the UK with neurological conditions. We know that obviously mechanisms of action, so the reason for those conditions differ, but however, how they present and how they affect a person's life often are shared across conditions. And I'm sure you guys in Neuro Social see this because you've from multiple conditions. So the experience and stuff is often shared. And this is part of us showing that, to try and show that there is a pull for, because a part of the reason why neuro is not recognized is that because there's so many different conditions. So whereas cancer, you've got bowel cancer, breast cancer, prostate cancer, etc., etc. With neurological conditions, they've all got different names. They don't say cancer after them or neurological condition after them. So they're a condition and a neurological condition. And that's part of the reason why we're doing this, is to try and sort of say, look, there's a power in the 16 million. So that whole idea of rising tide floats all boats is that we make a noise about neurological conditions, and then we can also then state about issues between conditions, experiences in condition, and also locations that we do, and all sorts of different bits and pieces we'll be able to do, ethnicities, the other demographics we're trying to do to try and recognize those gaps in the market, gaps in care, support, just generally how people are affecting their lives. I'm just going to choose two just out of, you can choose multiple on this one. I'm just choosing those, and then you can hit OK. This one, because it's a multiple choice, you will have to hit OK on. And we have put none of the above because some people have done that, and it'll be interesting to see at the end of the survey how many have selected none of the above, because then we might do a follow-up, because often with these questions, we do a follow-up set of questions in a later survey. After that, we've asked about, and as I say, this is again more specific to what we're asking now. I'm not going to go to the end of this survey, by the way. I just want to go through the general things. Again, this is specific questions relating to what we are now. How long? I'm just going to select. You'll see the functionality. You can go through the range. We try to do it as much as possible to cover everyone. Tell us more. So we do ask for what we call quantitative as well as qualitative questions. This allows you to put your story in your own words. And this does get used, and you'll see the words lifted, your words lifted and put inside reports, or maybe used in reports. We'll never use it with your name unless you've explicitly given us the right to do so. And even then, I don't think we've ever done that apart from in a case study. And even then, we've reached out to someone to speak about it. So we'll always say that one of our users has said this, and there's no way of tracking that. We have to be careful about which, because some people can put personal information in here, and we have to be sensitive on that. And we monitor these things as people go. And obviously, we do receive sensitive conversations that we need to deal with accordingly. I'm just going to put holding. I'm just putting holding message just because it's in there. I'm not going to go through. Next thing we start asking, and these are a set of questions that are asked every single time. It's something that we're going to look to improve on with the new version. So there'll be less sets of questions. This that gets you to ask, how was your experience of overall experience of care? And we're also, by the way, passing with this, we're also trying to pick up on the good and the bad, because ultimately we need to share good practice as well as highlight the holes and the bad, ultimately. So we try to make this as these surveys unbiased as possible where we can. Last time you wanted to speak to specialists, so it just asks you questions and you can just see, and I can just select through, and then where you're able to speak to a question. That will go through to the very end, and then at the end of the survey, there's a thank you. I don't want to go through every single set of questions. If you see these arrows down the bottom, it does allow you to skip on to the next question. You'll see with these questions, there's no star except until you got to those ones. So you'll see this little star here. That means you do have to complete this one. The next one you won't, but some of them you won't. Like you'll see here, that one doesn't require being completed because not everyone feels comfortable sharing every piece of information. We recognise that, and we want to do that. So I'm hoping you understanding or seeing the sets of questions that we ask and how this functionality works. As I say, I don't want to go through every single thing, so we could be here forever as I talk and waffle on. Plus, I'm terrible for waffling on, as Kate and Eva will tell you when you're doing it. But I'm open to questions. I'm going to stop sharing screen now, I'm hoping. I'm not sure how to start doing that because it's saying new share. No, I don't want a new share. I want to stop share.